Hi, I'm Harriet, and I write and podcast about the psychology of eating disorders. I personally recovered from bulimia and have worked as a therapist for 20 years. I hope to inspire, educate, and improve understanding about eating disorders through my writing and audio. Names used are fictional, and stories shared are a combined insight of many client experiences. I believe that full recovery is possible for everyone. So today I'm going to talk about CBT-E, cognitive behaviour therapy for eating disorders. So, does CBT-E work for treating eating disorders? So, it is one of the most favoured and researched therapies out there for eating disorders, and it actually means enhanced cognitive behaviour therapy. Now, if you access support for an eating disorder in the UK via the NHS, you may well be offered this treatment. So particularly if you meet diagnostic criteria for anorexia nervosa, bulimia nervosa or binge eating disorder. And the approach is described as transdiagnostic as it's relevant for several different eating disorder diagnoses. Now CBT-E, it's been around for a while actually, but it's only become a lot more mainstream probably in the last 10-15 years. But it was developed by Professor Christopher Fairburn and his team in Oxford around 2 decades ago. Now, it was initially a treatment for bulimia, but then it was expanded out to treat the other eating disorders too. So the lengths of treatment vary. If you're underweight, you are likely to have 40 treatment sessions over 40 weeks. Now, really important part of this process is that weight gain is an integral part of this process, accumulating as well in a period of weight maintenance at the end. So that's very central to it. And you're encouraged to engage with this weight gain process from an empowered choosing position rather than it being imposed by the therapist. So it comes from that whole motivational enhancement place where you're sort of stepping into choosing recovery. Now, if you're not significantly underweight, you'll receive 20 sessions over 20 weeks. So that's quite interesting, isn't it? There's a sort of difference there. I'm not really sure how right that is necessarily because of many people are not significantly underweight but still really, really struggling. But that's the way it seems to be set up. Now, sessions can be twice weekly to begin with for all of the CBT-E. And the idea with that is to gain momentum and build motivation early on. So to really get that kind of momentum, enthusiasm, kind of riding on the early honeymoon of recovery, I suppose, and kind of milking it for all it's worth. So CBT-E as well prides itself in not being a one-size-fits-all treatment. It's individualized to each client, flexing dynamically to incorporate each person's specific situation. Okay, so it's made up of 4 different stages. Number 1, stage 1 focuses on psychological formulation. So the therapist and client work together to establish a mutual understanding of the eating disorder as a coping strategy. There's also a focus on building a stable eating pattern through regular eating, balancing blood sugar. And this stage also incorporates psychoeducation and addressing concerns about weight and body image. Now, the next stage, stage 2, is a brief review stage where progress is evaluated and plans are made for future treatment before moving into stage 3. Stage 3 is kind of like the main body of the treatment, really, and this stage targets processes that perpetuate and maintain the eating problem. So this involves dissecting the over-evaluation you might possess in correlating weight and worth. It also involves problem solving around managing daily events and emotions, and it attempts to target and reduce various forms of dietary restraint. For example, things like missing meals, not eating enough, and delaying eating. And then stage 4 begins to shift to the future and coping and explores managing inevitable relapses and working on maintaining changes made so far. And then there's a review session, normally planned around 3 to 6 months after treatment to check in on progress and to target any additional issues remaining. So I'm going to talk a little bit about now my experience of delivering CBT-E. So I trained in CBT-E early on in my career. It was in Bristol, I think, in around 2003. And my foundational therapy approach, so when I did my baseline training, my sort of counselling diploma, it really prioritised the relationship between client and therapist, very sort of person-centred. So I have never really been a purist CBT-E practitioner because of that baseline understanding and way I like practicing. So what I tend to do with CBT-E is I integrate these skills into my overall framework, which involves person-centred therapy, motivational enhancement therapy, and compassion-focused therapy. So as much as I value and appreciate the CBT-E tools, I would personally struggle to follow a rigorous plan of sticking to the absolute specifications. But that's just me. I am an intuitive, feelings-led person. I really value the flexibility to lean into this when working with clients. So perhaps CBT-E purists would argue that I'm not actually delivering CBT-E after all. But I firmly stand for the middle ground, where you can utilise these highly effective tools whilst also having the flexibility to shift and move depending on the client's specific needs. So I tend to simultaneously work with clients on deeper issues alongside behavioural change, and I believe that can be very effective. So 5 reflections to consider if you're offered CBT-E. So number 1, motivation. CBT-E is an action-focused therapy. So to benefit, you need to engage wholeheartedly, showing a commitment to attending sessions and completing homework tasks. So you won't miraculously recover by passively cruising in your passenger seat and gazing dreamily out of the window. It can be challenging. So your therapist will guide and support you, but you need to have your hands firmly on the steering wheel. So you kind of really need to be motivated in the process. Number 2, directive. Now, if you enjoy a directive therapy approach and appreciate your therapist initiating, questioning and educating you, then you will thrive in a CBT setting. But if you prefer to free associate through speaking aloud and working through your issues by personal reflection whilst receiving gentle insights from your therapist, then CBT-E may not suit you. And in those cases, you may be better suited to person-centred or psychodynamic therapy or psychotherapy sessions. And I know actually for myself, whenever I've had therapy, I'm the kind of person that likes to talk. And when I talk aloud, it brings me a lot of clarity and self-awareness. So I actually like having a therapist who is not too directive. But having said that, back in the day when I had bulimia, if I had had a bit more of the directive specific skills, it also would have been really helpful. So again, I guess I'm saying from my more integrative approach to working on these things, I think a bit of both is good. But if you're doing pure CBT-E, your therapist will be more directive. Okay, number 3, the present and the future. So CBT-E focuses on the present and the future with little delving into your childhood history and possible adverse life events. So if you have experienced significant trauma, you may find that CBT-E falls short in helping you, and you may wish to seek out psychotherapy, somatic healing practices, or EMDR, eye movement desensitization and reprocessing. So not to say that you can't benefit from CBT-E in these instances, but you may need to focus more on the trauma aspect first and healing that, and then come to the CBT-E later. Number 4, creative tools, pictorial representations and psychoeducation. CBT-E can be a highly interactive and engaging therapy which can arm you with a toolbox of skills. Now this can feel empowering and equip you with a therapeutic chest of delights. Number 5, the need for a skilled practitioner. Anyone can train in CBT-E, however, it is a skill to deliver it effectively and to personally tailor the experience to the client. So if you have an eating disorder, you will understandably be hugely ambivalent about change and will need a skilled and flexible approach to navigate along the healing road. So CBT-E delivered in a dogmatic and prescriptive manner could potentially alienate you, the client, and trigger a shame response, causing withdrawal from treatment. So how effective is CBT-E? So the research statistics seem to vary widely. Focusing on studies in which CBT-E was delivered well, evidence suggests that 2/3 of clients who are not significantly underweight starting the treatment will make a full recovery. But these statistics are reported by the Oxford team, and I would say likely a little optimistic. The general consensus in the eating disorder therapy community is that CBT-E works for around 40% of people. It's beneficial, but like most treatment options, it is no magic pill. And it's not so great for clients who've experienced unresolved adverse childhood experiences. It's not always as effective for underweight clients. And clients that struggle with clinical perfectionism also may struggle with CBT-E. So anecdotally, I would say that the tools are excellent and a valuable addition to the therapy toolbox. But what do you think? Have you experienced CBT-E? Are you a therapist who has delivered CBT-E? How did you find it? Do send me a DM on Instagram if you would like to, or you can email me, harriet.frew@gmail.com, or you can put a comment below. Thanks so much for listening.